When hearing loss is permanent, cannot be treated medically or surgically, or when a patient chooses not to undergo surgery, oral rehabilitation can make a huge difference in quality of life. What is oral rehabilitation? The goal is to maximize communication skills. This may include auditory training, practicing listening and focusing on speakers, speech reading, lip reading, filling in the gaps when words are missed, speech training, conserving and strengthening existing communication ability, hearing aids or implanted devices, providing sound amplification or direct stimulation of hearing pathways, hearing guide dogs, helping patients stay safe and aware of important sounds, hearing aids. A hearing aid receives sound through a microphone, converts it to an electrical signal, amplifies it, and reconverts it to sound. Key points. Best for patients with sensorineural hearing loss, particularly when loss is 30 dB in the 500 to 2000 Hz range. They make sounds louder, but they do not restore clarity of speech if discrimination is poor. Background noise is often amplified, which can frustrate new users. Common problems: whistling feedback from loose or worn ear molds, dead batteries or clogged molds, poor fit leading to pain or skin irritation. Care tips, chart 59-12. Clean ear mold daily with soap and water. Keep device and ear canal dry. Check batteries, switches, and ear molds regularly. Watch for infection signs, pain, redness, swelling, or fever. Options and features, chart 59-13. T-coil for phones in large spaces. Directional microphones to cut background noise. Direct audio input for TV, computers, or stereos. Feedback suppression to reduce whistling. Types of hearing aids, table 59-4. Body aids, powerful but bulky, mostly for classrooms. Behind the ear, common, economical, easy to adjust. In the ear, small, custom fit, cosmetically appealing. In the canal, smallest, most discreet, but require good dexterity. Implanted hearing devices. Bone conduction devices. Send sound through the skull into the inner ear. BAHA, bone-anchored hearing aid, for conductive or mixed loss. MEI, middle ear implant, for sensorineural loss. Middle ear implants, IMEHD, piezoelectric or electromagnetic designs. Partially or fully implanted. Candidates, adults 18 with sensorineural loss who did not benefit from conventional aids. Pros: better sound quality, cosmetic appeal, allows active lifestyle. Cons: costly, requires surgery, battery recharging, variable output. Examples: Vibrant Sound Bridge, semi-implantable, electromagnetic. Envoy Esteem, fully implantable. Piezoelectric. Cochlear implants, for bilateral profound sensorineural hearing loss when hearing aids fail. Directly stimulate the auditory nerve. Do not restore normal hearing, but allow recognition of environmental sounds and speech. Over 324,000 recipients worldwide. Benefits: improved speech understanding and social interaction. In older adults may even delay progression of dementia. Requirements: profound bilateral sensorineural loss, poor speech recognition with hearing aids, no contraindications to surgery or anesthesia. Surgery: receiver placed in temporal bone, electrodes threaded into cochlea, external microphone and transmitter worn outside, requires months of rehabilitation and training. Limitations: variable success rates. Prelingual patients may take years to develop speech. MRI inactivates the implant, only done if absolutely necessary. Hearing guide dogs, for individuals with severe hearing loss who live alone. Specially trained hearing dogs can provide vital support. Roles of a hearing guide dog: alert the owner to important sounds, doorbell, phone, alarm clock, baby's cry, smoke alarm, intruder. Guide the person to the source of the noise. Provide protection in public by positioning between the owner and potential hazards, such as traffic or threatening individuals. Legal protections: certified hearing guide dogs are allowed access to public transport, restaurants, and stores, including food markets. Center summary: oral rehabilitation helps preserve and improve communication for those with hearing loss. Hearing aids are effective but have limits. Proper care and realistic expectations are key. Implanted devices, BAHA, MEI, cochlear implants, expand options for patients with conductive, mixed, or profound sensorineural loss. Hearing guide dogs offer safety, independence, and companionship to those with significant hearing impairment.